In this section, we're talking about immune deficiency syndromes that involve the innate immunity. First up, we have leukocyte adhesion deficiency. People with this disorder have defective neutrophil and lymphocyte migration. So the most common type of leukocyte adhesion deficiency is known as type 1. And in this, there is autosomal recessive defect in CD18. This is also called the lymphocyte function associated antigen 1, or LFA1. This usually formed by the beta subunit of several integrins, which are adhesion molecules. Therefore, a defect in this will cause for the white blood cells, especially the polymorphonuclear leukocytes, unable to roll or migrate to the inflammatory locations. In a newborn baby, when there is a delay in separation of the umbilical cord, and after the cord is cut, inflammation occurs. And the cord stump normally falls off 2 to 3 days later. In this case, this is delayed in LAD, which can be delayed to over 30 days in a classic presentation. An infection can occur called an omphalitis. Other findings include recurrent bacterial infections and neutrophilia, especially during infections. Next up is the Chidiac-Higashi syndrome. This is the failure of lysosomes to fuse with phagosomes. There's usually a mutation in the lysosomal trafficking regulator gene, which is the LYST gene. This causes for the microtubule dysfunction. As a result, these children have recurrent bacterial infections, especially by Staphylococcus and Streptococcus. And the clincher for this condition is something called oculocutaneous albinism. So the children have fair skin, blonde hair, and light blue eyes. The reason for this is that there are granules containing pigments in cells that are transferred through microtubules. And since these are defected, they cannot be transported. So children who do survive often have severe neural impairment. They have peripheral neuropathy, which causes for weakness and sensory deficits, and this causes for them to be on wheelchairs pretty early on in life. And finally, we have chronic granulomatous disease, or CGD. In this disease, there is a loss of function of NADPH oxidase. Phagocytes use NADPH oxidase to generate hydrogen peroxide from oxygen. Patients with this condition do not get infected with catalase-negative bacteria. However, catalase-positive bacteria can cause the infections, as they do not produce hydrogen peroxides that the phagocytes can use. 5 organisms cause almost all of CGD infections. These are Staphylococcus aureus, Pseudomonas, Serratia, Nocardia, and Aspergillus. And this concludes our videos to immune deficiency syndromes. We hope you enjoyed this video, and for more videos like these, keep watching sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.